MRI or CT scan? Which one is the best? In previous episode we reviewed X-ray based medical imaging techniques. Now it's time to check out non-X-ray based methods. These kind of methods are designed mainly for human body's soft parts. Because X-ray beam passes through soft tissues easily and cannot give us detailed images and data. These methods are much more safer than X-ray, both for patients and radiology operators. First, MRI, or magnetic resonance imaging. MRI is a newer medical imaging method than others. This method takes more time to create digital images of the selected body part. It uses a powerful magnetic field to align the protons of each hydrogen atom in human body magnetically, and creating some new energy levels in nucleus temporary. Then by sending RF signals in specific frequencies, the protons will gain energy, moving to a higher energy level. As the RF signal source deactivates after a short time, the protons will return to their normal state, releasing the excess amount of energy in a new frequency. The RF electronic detectors will receive and collect data. Finally, all digital data goes into a computer for signal processing and creating medical images. Like other imaging techniques, MRI has some strengths and weaknesses too. Strengths are: 1. Higher vision contrast compared with CT scan. 2. Producing images in multiple and various angles. 3. Much more safer than X-ray based methods. And weaknesses are: 1. Taking more time to produce medical images. 2. More expensive method and less medical centers are equipped with. 3. Reduction of image quality significantly by any sudden movement during scanning process. There are 2 precautions you need to know. 1. Patients with some types of implant in their body, especially which were used in past decades, are not allowed to use MRI and must inform the operators before doing scan process, because powerful magnetic field could move the implant or make it very hot. Remaining motionless for several minutes in MRI scanner narrow tunnel could be difficult for people with claustrophobia, which means fear of getting stuck in closed and narrow spaces. In this situation, patients can go to a medical imaging center equipped with open-type scanner. And now let's check out medical ultrasound. Medical ultrasound technique, also known as sonography or echography, is a non-X-ray method which uses very high-frequency sound wave and its reflection to study the desired body part. By sending sound wave continuously via an electronic probe, and moving it in different angles manually, a clear and live view of the area will show on the main device screen. By recording it or printing images, your doctor could have a perfect report of your current state. Medical ultrasound is a precise and safe method for diagnosing diseases like 1. Kidney stones or other kidney problems. 2. Fatty liver and other liver diseases. 3. Some heart dysfunctionalities. 4. So many diseases in pancreas, stomach, bladder, prostate, testicles, ovaries, uterus or womb, and other human organs. As you see, there is a variety of medical imaging methods. Your doctor chooses the proper imaging technique for your current problem if needed. So all you have to do is explaining your problem to your doctor.